Dr. Nurse Podcast. Thank you for coming on and taking the time to listen today. Today, I have Dr. Stephen Ferrara. He is an actively practicing family nurse practitioner, executive, and faculty member. He combines years of clinical experience along with health policy development to increase access to nurse practitioner partnered care in the state of New York City by serving as an executive director of the Nurse Practitioner Association of New York State. He's also the Associate Dean of Clinical Affairs and Associate Professor at Columbia's University School of Nursing, where he leads nurse practitioners as a primary care faculty and in their clinical simulation. He serves as the Executive Director of the Jonas Nursing and Veterans Healthcare, and he is the Region 2 Director on the board for AANP for the last 6 years. He's received many awards for his health policy work, with his most recent being inducted as a fellow into the American Academy of Nursing in 2020. Guys, please welcome Dr. Ferrara to the podcast. This is actually a challenge, especially in this space, right? That's mostly dominated by women. And that's kind of what I wanted to hear more about, is just kind of some of the challenges that you faced and you had to overcome through being kind of different in this space.
100%. I would work with female colleagues that were not so accepting. And I don't think it was just female colleagues. I mean, I think being a nurse is hard, right? We've heard the sayings before, nurses eat their young, and it's a hard profession to break through. And, I think whatever else you add on top of that just makes it that much more challenging, right? So, yeah. So there was the perception that, oh, why are you just being a nurse? I said, because this is what I want to do. This is how I want to connect with patients. And then, I was, my sexuality was questioned,
Oh my
why do you want to be a nurse? So again. Oh my gosh. It is what it is. And I said, look, I'm not really being so concerned about what others, think or do or say. And we mentioned this a little bit earlier, I am a fellow of AANP. I'm a fellow of the American Academy of Nursing. And these are honor type of designations. You have to apply to it. You need a sponsor. You need 2 sponsors to support your statement. Oh. And, it's nice to be recognized doing the work that you do, that one does. And to sort of get this, honorary title to say you have attained this recognition of work, of a body of work. We recognize and appreciate you. Yeah, that's really feels good. I don't do it to get, to say I am a fellow, but it is an honor. And as far as, AANP goes, there are less than 1,000 fellows in AANP. There are over 325,000 nurse practitioners in the United States. So it is nice. And in the American Academy of Nursing, I believe there are 2,800 fellows worldwide, and there's 4 million nurses in the United States. So it is really nice. It's really nice. It's a really nice thing. But again, I don't do my work so I can get that. Sure. So.
But I think one of the things to note is that it requires a level of expertise and a level of focused intention in your career to obtain something like that. One, I think there should be these awards for nurses out there to encourage hard work. I mean, let's be real, right? Like, we work to get paid. We work for a certain amount of, not applause, but maybe I don't know what the right word is, but we're working for something. We want to feel like we're working towards a goal. That's what I'm trying to say. Absolutely. We're working towards a goal. We need to create these goals, because if not, then people don't know what should I be shooting for. And there's nothing wrong with going, hey, I shot for that and I hit it. I got it. I think that's something to celebrate. I think that's something that more nurses need to be embracing. We have all-stars in our midst. There is 100%. Nothing wrong with doctors do it all the time. Yeah, that's right. He's got the Golden Cystoscope Award in urology. And it's like, what? He actually got a cystoscope in gold? Are you kidding me? But why not, nurses? have and create these same awards for nurse practitioners and nurses that are doing incredible things with their careers. And again, shooting for these goals. I love that. I think it's great. Never feel shame about it. I'm going to promote it and say, yeah, I know that guy.